Our society places an incredibly high value on health, fitness, and beauty. We want to stay young and attractive. The idea of wilting away and growing old frightens us. We want to separate ourselves from a stage we associate with death. Just how bad will it be when you get old? Well, a lot depends on how healthy you are now. With older age comes physical difficulties that are inevitable and usually unfixable.
They stop trying to fix shit when you get to be 40. They just go, yeah, it starts to happen. They don't care.
Past 40, how about past 60? Within 20 years in Canada, there will be twice as many people over 60 as there are now. These elderly people will likely face discrimination when they enter the healthcare system. We know that because it's happening now.
The healthcare system itself doesn't think it's ageist, but I can tell you our members think it is. I can't tell you the number of times when we've heard from our members who call us, sometimes from the hospital doors, saying, you know, I'm pretty sure my wife did not get the treatment that she should have done because of her age. And other times the doctors have come right out and said it. You know, you really shouldn't expect better at your age. Listen to some of the words that are used, bed blockers, you've heard that term. You've seen even well-meaning commentators call it a gray tsunami. It's as if it was their fault.
So how has ageism crept into the medical profession?
Doctors are human beings too, but older people who come and see doctors can run into people that are demeaning towards them. I think it takes a special kind of physician to be interested in working with older people. And I think that does relate to very deep but changing cultural attitudes about what it means to be an older person.
The way we think about doctors and nurses now is changing. It used to be that they were gods. They are no longer. People are prepared to do their own research. Okay, the internet is not perfect, but it does give you some general information. And that means that people are better informed and better resourced to at least challenge the kind of advice that they're giving. And I think that's going to balance things out.
The only way attitudes will change is through education.
The medical profession can help itself by learning more about how to deal with older patients and the challenges of aging, because they too will be aging. Right now, we only have about 250 geriatricians in all of Canada. The estimated need is about 1,000.
The notion that there is a positive side to aging, what it's like to grow old and perhaps emerge as a wise elder, that's something that the medical students really need to hear and to aspire to help their patients become.
Dr. Whitehouse offers these tips for an older person's first visit to a physician. 1. Print out your medical history to show the doctor. 2. Bring someone with you to the appointment. 3. Come prepared with questions for the doctor. And finally, don't let any healthcare professional dismiss your concerns.
I think the most important thing that an older patient and their family needs to be aware of is that they have rights. And they don't need to internalize the ageism that they see in the healthcare system or in society at large. And I think the more that people push back, ask questions, the more likely they're going to be comfortable with the answers.